Welcome, everyone, to this month's Public Health Roundtable discussion. We are going to be chatting about the topic of Heart Health Month. My name is Dr. Charlotte Hughes Huntley, and I am joined by this wonderful panelist, Ericka Horne. For introduction's sake, in case you're not familiar with who we are, I'll start by introducing myself. I am Dr. Huntley. I am the CEO and founder of DrCHHuntley LLC. We are a public health consulting firm. We specialize in epidemiology and we support large nonprofit organizations and some government organizations that specifically focus on BIPOC communities. And we provide support in the way of helping them understand and communicate their data and their health information in plain language. So that could look a number of different ways, but we enjoyed that work. Our data team really delves into some of the communities and our clients that we serve. I'm also the host of the Public Health Epidemiology Conversations podcast. We have a new episode every Tuesday, so we hope that you'll check that out. Ericka Horne is awesome. I can tell you that, but I'm going to let her introduce herself to you as well.
Hello, everyone. My name is Ericka Horne, as stated. I am the CEO and founder of Akiri Consulting. We are a new business, and what we do is provide support to faith-based organizations, community-based organizations, nonprofits, with regards to program planning for health events and providing support for strategic planning and just all things related to trainings when it comes to mental health trainings and kidney coaching and just providing support for those organizations and for the communities that they serve. So we're able to come in, help you plan the event that you're trying to plan, and speak at those events if needed, and provide those trainings as they are needed as well. So that is what we do at Akiri Consulting.
Let's kind of pivot into our topic. This month is February represents a lot of things, but we're going to focus in on it being American Heart Month. And I know that in other countries, they also kind of recognize this month as awareness for heart and heart disease and prevention and all the topics related. I want us to talk about, how we are kind of addressing this. How do we communicate about this topic in communities that we serve? Our organization, we do serve BIPOC communities. We do a lot of work with tribal organizations on a community level. Like I said, whether it's whatever the data is, we're trying to help them understand or really translate it so that the community, the individuals within the community have a better understanding, make it more relatable. But I think what I want to kind of talk about from my perspective is I talk about these communication tips, and it feels like overload, but I often see these organizations with big hearts, well-intended folks, and we're talking about a lot of government organizations as well, public health departments. They're staffed with people who really care, have this heart to serve, but there is often a disconnect when we get to how we communicate what we want to share on a community level. And heart disease is one of those topics. How we talk about the challenges and the risk can be not really well, received on the end, for the community member as is intended. So that disconnect happens, I think, sometimes when we are losing connection with the people. We have to get people in the community involved in what we do. So I see this because I have conversations. For example, now that I've cut all my hair off and I wear this really, this keep it shaved down low on the side. I go to a barber. I actually love going to the barber shop. It was really awkward for me at first because I only taken when my boys were young, I dropped them off at the barber shop to get their hair cut. I didn't have a personal experience with the barber shop, but I was welcomed in and they take really good care of me. And while sitting there is all this conversation that happens. I am a trusted member of the community in the barbershop, so they don't filter anything for me. Sometimes I wish they would, but but I'm hearing things and I'll get questions because they trust me and I'm there. And my nickname there is Doc. They don't call me Dr. Huntley. They don't call me Charlotte. They call me Doc, and that's fine. And so I'll get all the time. So Doc, I have a question for you, right? And then we'll go into something on a topic. And I find often myself, I'm sitting there and I'm having like different perspectives are running through my mind. From the public health perspective, I'm hearing about, the programs and how we connect to the community through the barbershops and the beauty salons. And I'm running through my mind all the programs. And then in real, like the real scenario, I'm realizing that sometimes all of what we want to talk about, we have to peel back so many layers. And
Yeah.
sometimes it's the simplest bits of information that they really need and really want and really want to understand. I think sometimes you only get to that by being involved, being actually involved. So I wanted to share that as kind of because so much information will be kind of thrown around, post,
Hmm.
get this PDF and this fact sheet and do this and do that. And I think that it gets lost.
No, that's a really great example because, as you mentioned, those programs, they were created to be in those spaces where they know the community goes. And I think a lot of the times, when I go get my hair done, if I go to a salon, and at one point I had a shave size, so I used to go to a barber. So it's like I get, all those different dynamics. And it really is, like you say, bringing it back to making it simple. I was talking with a colleague of mine yesterday, and a lot of times we get these ideas and they sound so profound, and we're like, oh, we're going to do this, that, the third. And it's like, but honestly, that revelation could have been just for you to get to understand it. But you got to make it plain. You got to make it simple. You got to bring it all the way down. I get to work with some mentoring organizations, and I do some health education events with them often. And they're probably my favorite groups to work with at times because they ask the questions that you don't even think of. They're so
Yes.
young and they're just so impressionable, and they're ready to ask you, well, how does that work? And you're like, oh, wait, I just never really thought about it. So it really challenges me in a good way to really dig deep. And how do I make this understandable that even at a young age, you understand the importance of your heart, you understand the importance of your blood pressure, of what cardiovascular diseases. We think of American Heart Month, and there's so many parts to it. It's very intricate, and most times you think, oh, okay, American Heart Month. Okay, cool. But there's, cholesterol, high blood pressure, stress, all the different things that play into your cardiovascular health, and trying to connect it and making it plain like these all play a role. They're all important. You have to consider your stress levels, what things are causing you to stress. You have to consider your blood pressure. Do you even know what it is? Do you know why these numbers exist? Like, what's important for you? What's your normal? And just trying to get them to be empowered in their own understanding of their health as well. Like having basic conversations, bringing it down, and having them in small groups really helps to help that understanding for the community. The fact sheets are great. I love them. I bring them when I have to go to events, so someone can have them as a point of reference. But when you get to have that one-on-one conversation or that small group conversation, you really get to dive a little bit deeper to what the person really needs. And then you're really making an impact on the community.
Oh my gosh, I'm so glad you said that. Everything you said is like spot on. I agree. And you mentioned fact sheets. I'm glad you did because I really want to personalize a couple of things like as we dive into you talking about the conversation, right, and communicating that. I want to think about, and this can go for any population, right? But if we think about heart disease is the leading cause of death in the United States, that kind of is what it is. But we know that we can reduce our risk by a number of factors, things that we can do to, increase our heart health and reduce our risk for disease. One of the things, this is personal interest of mine, is moving more, physical activity. It was part of my dissertation research, kind of a part of the finding, the ways that physical activity can kind of improve so many aspects of our life. But
Mhm.
speaking about heart health, and it doesn't take a lot. Moderate intensity exercise, we can go into the weeds about that, and there's a lot of different metrics, but just a little bit. I'm going to go with 30 minutes of physical activity 5 times a week is a great way to aim for reaching these minimal goals, these recommended goals from, multiple agencies, NIH, American Heart Association. So I looked up and found a fact sheet that I really like. Let me just repeat or share some of the information. So, if we think about moving more, and I'm going to tell you a personal story that got me on this. I've always had this habit, this routine of early morning walks. I would get up
Mhm.
early in the morning. I would, and it started with early in the morning simply because that was the only time of day that I could protect before everyone else needed me for something. So if I
Mm.
tried to walk at the end of the day, I would get distracted with all the things that would come up that people needed me for, by that time. But if I got up really early before everybody else, I could get it done. And so that became my time years and years ago. So I got off that pattern toward the end of last year. I could blame, I was grieving the loss of my mom, and I could blame, oh, I was going through that. But it's a mixture of things. It was like the disruption in my routine. I was traveling a lot. There's just a lot of disruption. So I got off that pattern. I was walking here and there. Another thing I started doing, this is a thing you should do, is move more, meaning like when you're working at the desk, like my meetings intentionally are like designed to end, 10 minutes or so before the hour so that I can get up, move around a little bit and, be ready for the next meeting. Or I invested in a really nice stand-up desk, which, were wonderful, right? So I could
Yep,
stand up, raise the desk and stand up for one meeting, or lower the desk and sit down. Um,
exactly.
Somewhere along the way, I moved away from that pattern. And
Mm.
I found myself with that little break between meetings when I have back-to-back meetings, I would use that break to fill in my notes and get ready for the next meeting, but without getting up and moving. So I would end up spending the whole morning sitting at my desk. It's easy to kind of fall off a pattern. It's easy to get lost in this. So how I really kind of busted myself was I had a very old Apple Watch, really old.
Ah,
It was really old, and it wasn't working that well. So I updated, and I got a new Apple Watch, and I was complaining. I said something was wrong with the old one because I could never close that move ring.
yeah,
Those Apple
yeah.
Watches I'm talking about, and I'm thinking something's wrong, and because I walk in the morning, even if I walked in the morning, I would do these things, but I would sit for these long periods of time. So when I got my updated watch, I was kind of really starting to pay attention to the metrics. And I realized that's when I started to review what I was doing. I realized I was sitting for these long blocks. So I'm telling you all my business because it's easy for us to still keep saying, this is what you need to do on one hand, but not be doing the thing on the
Hmm.
other hand, right? So as soon as I kind of realized that, I got back into every hour making sure I get up, move around. I either go get water, I walk downstairs. If I'm downtown I have an office downtown. If I'm down there, I have to get out and walk. There's like a big circle you can walk in the hallway. I have to move around, right? In every hour. And I started watching and tracking myself. And just that little bit of additional, activity and being really aware of it and being cognizant of it, I find myself getting back to where I was closing those move rings and I was getting those, levels up. I got myself back on my early morning, routine. And I found, a pattern I can walk that gives me 30 minutes first thing in the morning. And then I go on to something else. The whole moral of all that is it's easy to get off track and we won't realize we're off while we're busy telling other people what they need to do. We can personally not be doing it. But it's also very easy to get back on course and to insert some of those things in.
I really love all of that because so often we get so caught up in the day to day. And, in the beginning of the year or towards the end of the year, there's a lot of disruption of our calendars of life, all the holidays, the travel, you're with family, you want to rest. And then the beginning of the year is when everything's like on go. So you're trying to get all your things done as you plan for the upcoming year. And I recognize even for myself, like my Apple Watch, it would be easy to say, oh, well, I'm just going to lower the amount of hours I want to be in my goal. And I was like,
Right.
no, because that's not helping you. So,
Right.
literally, that reminder that pops up, hey, you haven't moved in this past hour. It's such a beautiful conviction because I'm like, you know what? I need to
Yeah.
be moving and I'm not moving right now. I'm not
Yeah.
standing. All the same things. Like I intentionally made sure I got a standing desk so that I can stand and sit and keep moving because I realized when there was a period, I'll say like it's almost been 2 years now when I was not taking care of myself. I had a few health
Right.
risks going on, but there was a lot of stress, and the stress was
Mhm.
causing problems on my heart. Like there was no way you could tell me all the things that I was experiencing, and I ended up having to have like my gallbladder removed, but the leading cause, by the time we got down to the root of it, talking to my daughter and everything, was stress with everything going on with school and my old job and all these things happening. So I was just like, yeah, we can't let that happen anymore. Like I had
Mhm.
to make a conscious decision, like, okay, if I'm going to be the person that's here advocating and empowering and encouraging others to take action in their health and make it a priority, I can't not be doing the same things. So
Yeah.
I have to be who it is that I'm trying to help others become. So it really just helps me realizing that people do look up to me and they look up to the work that I may be doing. And it's like,
Mhm.
if I'm going to continue to do the work, I can't do the work if I don't have a functioning heart. Like if I'm no longer here, I can't continue to do the work and help others and serve the communities the way that I want to and the way that I love to do it. So it really is so important taking care of ourselves and our own lives, because we truly are an example for others to see, okay, the importance of, wow, she's always drinking water. Oh my gosh, her skin is so clear. I was like, yeah, I drink my water, I go for my
Uh-huh.
walks, and I mind the business that pays me. So it's
That's
like these are
right.
things that are gonna help you out. But literally just being able to know, like, okay, I cannot be who I need to be if I'm not for you, if I'm not taking care of me. So it
Right.
really encourages me for others, especially because I do a lot of work with youth. I do end up speaking a lot with young ladies and mentoring them in some capacity in group settings or one-on-one settings, and young adults also. And in order to do that work, I have to be able to be there and share that knowledge. So
Right.
all the information from the fact sheets, if they're not going to read the fact sheet, I need to be able to know it enough to share with
Yeah.
them. But I can't share it with them if I'm not around to do it. If I can't
Right.
relate to them on the level they're in. And a lot of times, depending on the fact sheet, we may get them from a trusted source and they're great, but the person, the community we're in, may not be able to read at a certain level. They may not understand it. So it's like, it's my role, to break it down for you to understand. Bring it back and relate it to something you're familiar with. Are you in
Mhm.
school? What community are you in? What are the challenges that your community is facing? Let me make it plain. Let me relate it, make it relatable so that you understand why you should know your blood pressure, why you should know your
Yeah.
cholesterol, your HDL, your LDL. You got to know all of these things, but because it seems so abstract, we try to stray away from it. But when we get to the point where we truly care about the communities that we're serving, then
Mhm.
we'll do what it takes to break it down for them, regardless of where we are. And I
Yeah.
think that's another part, the disconnect that we sometimes see with community and communications is we're not speaking on their levels. We're not speaking from a perspective that they understand. We just stay where we're comfortable in, and we're siloed into public health sometimes, but we aren't in the community enough to be able to know this isn't going to resonate well because they don't understand this example. What example works for them and one side of town may not work on the other side of town. So actually being involved in the community and seeing what works, who are those key stakeholders in their community, how do we actually get in to talk to them, and what is going to be relatable to those that we're serving. Like those are all key, especially because it's the number one leading cause of death, like you said.
Exactly.
Like
Yeah.
we all are guaranteed to die, of course, but if we can minimize the risk, if there's something we
Right.
can do
Exactly.
to prolong our life, then why not?
Yeah, exactly. Exactly. This is a part of, this adds into that being relatable to the communities we serve. So when I talk about what I'm personally doing, even when I talk about, very openly about when I mess up, but it makes it, I'm relatable. I can connect and it's very genuine. I wanted to share some fact sheets that I found to be really well done. And I just want to share a couple things as we wrap up, because I want you to feel like if you're listening to this and you're thinking, gosh, I do sit at my desk too long and or maybe I need to talk to somebody about this, but I want to make it super easy. So let's just say they give some really good, considering 10 minutes, right? What you can do, how you can do this in 10 minutes. So if you only have 10 minutes, you can start walking for 5 minutes, like take a brisk walk somewhere for 5 minutes. I've set timers like every phone has it, your watch probably has it. Set a 5-minute timer, and when that timer goes off, just turn around and come back. So then, you've walked for 10 minutes. I mean, that seems doable. This is one that Erica and I've talked about this a lot, and I've done this. Dancing.
Oh yeah.
Um, you know, Standing or seated. My husband can definitely do a seated dance. He's one of those people that keep the beat when he's sitting down. I'll let him stand up and dance. But dancing to 3 songs.
Mm.
That's another way to fill in 10 minutes. And I like that one because, I mean, you can do praise dances. You can do, just pick your favorite hype dances, your hype music, and just, pick your favorite songs from the 80s. For those of you who were here in the 80s. And, whatever that is. But I think a dance break is super nice, especially if your work is real intense and heavy. Sometimes that can just give you another like mental boost as well,
Yeah.
shaking it off kind of thing. So, and then another thing, if you're, this is like if you're on transportation, public transportation, for example, get off your bus early and then walk the rest of the stretch. So maybe get off a stop early than you normally would and walk the rest of the way just to give yourself, that opportunity
I
for
like
the
that
extra 10
one.
minutes. So those are just some easy ways. You could probably think of a whole lot more as we're talking about this. But the whole idea is for all my public health friends and colleagues, put that mirror up in front of you for a moment and think and look at
Mhm.
yourself and what are you doing to take care of yourself? How are you moving more? How are you practicing, heart health? And then look into how you can implement any strategies to better communicate this to who you serve.
Two
So that's
things.
that's my final kind of take on this topic as we wrap up. Ericka, do you have any final thoughts or words?
I just wanted to add even like two things I noticed I've also done to help me is parking lots. If I'm going to the store, I used to be the try to find the closest one. Now I don't mind parking a little further just to get a few extra steps in.
Yeah.
And then I would intentionally try to go through a building to take an elevator to avoid stairs. So now
Right.
I park by the stairs and I try to take more stairs instead of elevators when I have to go in buildings. Thinking about it, like you said, it's the little things. It doesn't have to be some drastic, huge thing. Everybody may not be able to afford a gym membership,
Right.
but the earth is free. We live here. You might as well take advantage of the earth that we live on and the sidewalks that we have and the grass that we have access to, the parks. They're all free. It doesn't have to be something extensive and expensive, and a lot of times health gets bundled into expensive. So if we can just kind of even help remove that barrier and that mindset to health, like, oh, it costs so much in order to get a gym membership. Well, walk around your neighborhood, walk in your
Yeah.
house, walk
Yeah.
from one room to the other room, walk around your house. Like, it doesn't have to be as hard or as difficult as sometimes it gets seen or gets thrown at us. So as we do that self-reflection and we're thinking about how we can improve our own health, what are some ways that we can do it for ourselves? And then for those communities that may have difficulties or that's a challenge, a barrier is finances. How do we show them what they can do in their own house, in their own neighborhoods that can still be beneficial to them?
I have a rule, and I've mentioned this on previously, like in our podcast, on my podcast. I have a no eating at the desk rule.
Oh, that's good.
Yeah, like, I mean, I can have a snack. I may bring, like, a fruit snack or something like that, right? I love to munch on fruit. I'm obsessed with, like, fresh fruit in
Yes,
season. Love that. But,
same.
so I can do that, but I cannot take, like, my lunch at my desk. That's, like, a hard no, like, a non-negotiable rule.
Yes.
So I started that for my home office to force me to get out of this room, at least go somewhere else in the house and eat my lunch and then come back to actually have a regular break. When I'm downtown, I got the office down there and you can customize. And I was like, oh, I think I'm going to put like a refrigerator here so that drinks are convenient. My husband's like, absolutely not. And I got a little bit of attitude at first, but he was like, if you do that, then one thing will lead to another and you'll start eating in the office. So we have
Mhm.
like when I'm downtown, I have a no eating in the office in terms of like a lunch.
Yeah.
So that I will pack my lunch often, even if I DoorDash my lunch, I have to go into the other break area on the floor up, take the stairs up, and eat my lunch. Those things will help, back to the point, with, incorporating extra, reasons to get up and move to keep you from just sitting at the desk. Because most of us would just work right through the desk, right?
Mhm.
Everything, the whole day, right from our desk, if we could. So thank you, Ericka. This has been a lot of fun. Thank you for sharing all of the, tips, insights, advice on this roundtable discussion. Some really good things that you raised for people to think about. And I hope that those of you joining, whether you're live or watching the replay, share your tips, thoughts, in the comments with us. I'd love to. We'll read those, come back to those
Mhm.
as you share your thoughts and reply and respond to. You can keep that discussion going. And yeah, join us again. We host the roundtable discussion the first Wednesday of every month, different topics. So we hope that you'll join us.
Yes, join us next time.
All right. Take care, Ericka. Have a great day.
You too. Thank you.